Hi, everyone. Before we dive in today, I want you to take a breath and just tune in for a moment. Not to me, but to yourself. Think about what's been resonating with you lately in this course. Maybe something a client said, or a line from Szalavitz that stuck with you, or even a reflection from one of our previous modules. Last week, we explored harm reduction, collaboration, and deep listening, all ways of staying present with people exactly as they are. And those themes don't end there. They're the rhythm section underneath everything that we do in counseling. Harm reduction invites humility. Collaboration reminds us that clients are experts in their own lives. And deep listening, the real kind where we quiet our internal noise, that's the bridge that connects us. This week, we're going to shift from harmony into soloing. We'll talk about what it means to center the client's voice, especially when the counselor has information, experience, or advice to offer. In a way, this is like learning how to play backup without losing the melody. The client's voice should always be the loudest instrument in the mix. And come as you are, Szalavitz reminds us that recovery isn't about fitting into somebody else's songbook. It's about being met exactly where you are, as you are, even if the notes are raw or out of tune. That's a radical act of respect. It asks us as counselors to drop the impulse to fix the sound and instead help the person hear their own rhythm. Carl Rogers talked about this as unconditional positive regard, the kind of loving curiosity that says, you're enough even in this unfinished form. In Gestalt theory, it's more about contact or showing up fully in the here and now without pushing the other person to be somewhere else. And in motivational interviewing, this is where focusing comes in. And before we start the song, we have to agree on what key we're in. We find shared direction. Maybe the client says, I just want to feel more in control, or I want to stop disappointing my family. Our job isn't to decide the tempo or write the lyrics. It's to understand the tone, the heartbeat behind their words. So as you move through this module, try listening not just for content, but for tone. What's the melody beneath the client's story? What do they keep returning to? The emotional hook that carries their meaning. Because every person you work with has a song inside of them. Your task isn't to rewrite it, and it's not to remix it. It's to help them hear it more clearly. Our readings for this week are looking at Salavitz's chapters 13, 14, and 15, and Miller and Rollnick's chapters 10, 11, and 12. I'm going to talk a little bit about that focusing that you were reading last week through Miller and Rollnick that I think that the lecture maybe didn't fully cover, so focusing is folded into this one too, and honestly, I feel like it fits really well here. So here's what we're going to talk about. First, we're going to talk about voice and power in treatment, and we'll look at how Salavitz's chapters challenge traditional power structures in treatment. We'll ask what it really means to center the client's voice and how that shapes treatment planning and decision making. And you'll be invited to pause and reflect on how this philosophy connects with your own counseling identity, especially when client autonomy bumps up against agency rules or old treatment habits. Next, we'll explore advice and autonomy, the art of improvisation. Here, we'll draw on Miller and Rollnick's guidance in offering information and advice, and we'll talk about the rhythm of the ask, offer, ask, that respectful back and forth where the counselor's role is to support, not overpower. We'll think about how to provide information ethically and compassionately without stealing the mic. And we'll pause to reflect on the tension between our ethical duty to inform and our commitment to protect the client's self-determination. Then we'll move into evoking change and remixing resistance. And this is where motivational interviewing skill set really comes alive. We'll look at evoking and supporting persistence through both motivational interviewing and harm reduction lenses and how we keep clients' motivation playing softly underneath, even when ambivalence or hopelessness tries to drown it out. We'll explore strategies for helping clients who've been silenced or disempowered by traditional systems to find their own voice again. And after that, we'll revisit focusing, and we can just look at that as staying in tune. This is our quiet check-in, making sure that we and the client are still in the same key. Look at how focusing shows up across these stages, not as a one-time agreement, but as an ongoing act of alignment and respect. And finally, we'll close with reflection and integration, and I'll offer some guidance for your quiz later this week. We're not going to talk about answers, but maybe just pathways or thoughts for your own exploration. You'll also have a chance to think about which parts of motivational interviewing feel familiar, what aligns with your existing approach, and what skills you want to keep practicing. And we'll wrap up by bringing it all together. The harmony between voice, advice, and persistence, and maybe a nod to some of those K-pop demon hunters who remind us that sometimes transformation means confronting our shadows and patterns and learning to dance with them. So, when we talk about voice and power in treatment, we're really talking about who gets to define what help looks like. For a long time, treatment systems have been built on hierarchy, where the counselor, doctor, or program decides what recovery should mean, and the client's job is to comply. It's a structure that can silence the very people that it's meant to serve. In Salavitz's chapters this week, she challenges that system head on. She reminds us that real recovery starts when people are invited to participate in shaping their own care. Her message is clear. We can't truly support somebody if we're not willing to listen to how they understand their own life. Harm reduction and motivational interviewing both move in that same direction. They're not about letting go of structure completely, they're about shifting who holds the pen. Instead of writing the treatment plan for someone, we are co authoring it with them. And that doesn't mean that we stop offering guidance or expertise. It just means that the expertise doesn't outrank experience. The counselor brings knowledge, the client brings lived truth. Carl Rogers captured this decades ago with his idea of unconditional positive regard, meeting the person where they are without judgment or agenda. It's a stance of deep respect that says, you matter as you are, not only once you change. Gestalt therapy echoes this too. In Gestalt, we don't try to fix or interpret, we focus on contact, being fully present and authentic with another person, allowing their reality to stand as it is. Salavitz's harm reduction lens fits right into that tradition. People don't need to become acceptable to deserve care. And from a motivational interviewing perspective, this is where focusing becomes essential. Before we start working towards change, we take time to clarify what matters most to the client, not just what we think should matter. That shared focus creates alignment. It's like agreeing on the theme of a song before practicing it. We both need to know what it's about. And without shared understanding, we risk drifting into conversation that serve our comfort more than the client's growth. When we focus collaboratively, we give power back to the person sitting in front of us. We're not telling them what note to hit. We're helping them recognize their own rhythm and decide how they want it to sound. That's what it means to center voice in treatment. It's not about volume, it's about agency. So Szalavitz emphasizes in Come As You Are and Nothing About Us Without Us, pointing to the importance of centering the client's voice in recovery. How does this philosophy shape the counselor's role in treatment planning and decision-making, and where might it conflict with traditional treatment approaches? Take a moment here. I'm really curious about your thoughts, especially knowing that you all work in some sort of substance use treatment center already. You have experience. You know what it's like to work in a compliance-based system or under a state license. Another way to think about this might be, when does the intention clash with the outcome? So let's talk about advice. Most of us became counselors because we care. We want to help people suffer less, make safer choices, and find peace. But sometimes that caring turns into what Miller and Rollnick call the righting reflex, the urge to fix, correct, or persuade. And it is such a natural instinct that half the time we don't even notice that it's happening. In motivational interviewing, offering advice isn't off limits, it's just done a little differently. Instead of stepping in with authority, we approach it as collaboration, not a correction. Miller and Rollnick described the ask, offer, ask rhythm, and I love how simple and respectful it is, and also easy to remember. First, we ask what the person already knows or wants to know. That step alone changes the tone, and it says that your perspective matters. Then we offer information, but neutrally, something like, would it be okay if I shared a few things that have helped other people in this situation? And finally, we ask again, what do you make of that? Does that fit with you? What are you taking away from it? The whole rhythm centers the client's voice. It lets them stay in the driver's seat even when we're offering directions. And from a humanistic lens, this is facilitative guidance rather than directive teaching. It's the difference between saying you should do this and saying, here's something that might be worth considering. The former shuts down curiosity, the latter invites it. And Gestalt therapy gives us even another way to think about advice, not as instruction, but as an experiment in awareness. You might offer an idea or technique the way that you'd offer a new brush to an artist. Would you like to try painting with this and see what happens? The emphasis is on experience and choice, not compliance. In motivational interviewing terms, this is also about maintaining focus. When we start offering advice, it's easy to drift off key and to lose the shared goal that gives work the meaning. Focusing helps us to pause and check. Is this still where you want to go? Does this feel useful to talk about right now? And when advice happens inside the shared focus, it strengthens alliance. And when it happens outside of it, it can quietly erode trust. So advice in motivational interviewing is really an act of respect. It says, I care enough to share what I know, but I trust you to decide what's right for you. And that's the art of improvisation, not taking over the melody, but finding ways to play alongside it. Now, if you've ever taken or watched an improv class, you know how much this connects to what we do as counselors. The foundation of acting improv is the yes and principle, the idea that we accept what our scene partner gives us with a yes and we build on it, and that's the and. And it's an act of radical acceptance and collaboration. You don't block or contradict the offer, you expand it, you co create it. And if it sounds familiar, it's the same mindset that underlies motivational interviewing. When a client says something that surprises us, frustrates us, or doesn't fit our plan, we can yes and it. We acknowledge their perspective fully and then gently build on it to keep the process moving forward. Instead of, but you said you wanted to stop using, we might say, yes. And it sounds like part of you still finds comfort in that routine. That's how we keep the energy alive, by joining rather than opposing. In both counseling and acting improv, trust, presence, and responsiveness are everything. You can't predict where it's going. You have to stay alert, attuned, and flexible. There's no script, only relationship. Every movement is an invitation to respond with empathy and curiosity rather than control. It's probably no surprise then that many therapists actually take improv classes to strengthen their counseling skills. Improv helps develop spontaneity, deep listening, and emotional attunement, all skills that translate directly into therapy rooms. You can learn how to listen with your whole body, how to respond rather than react, and how to embrace uncertainty with creativity instead of fear. So when you think of advice versus autonomy, imagine improv as your guide. You're not performing for the client, you are performing with them. You don't need the perfect line, you just need to stay present, keep the rhythm, and keep saying yes and till what unfolds. That's the art of improvisation. And at its heart, it's compassionate, collaborative, and it's counseling. So here's another opportunity to just take a minute to pause and reflect. Think about this question. If you're feeling bold, maybe give it an answer in the comments below. But I'm really curious about how you're thinking about how you balance the ethical need to inform with the client's right to choose. When has that balance felt especially hard? Sometimes I think about that metaphor of keeping the client in the driver's seat and maybe I'm in the passenger seat, or maybe I take a step to the back of the bus. But if a client starts driving towards a cliff, at what point do I say, ooh, we might want to stop? And at what point am I yelling, hey, you got to slam on the brakes so that we both don't go over the cliff? That's what I think about it. If it helps you to build out a metaphor about knowing when to guide versus direct, it could be a really cool way to unfold this. So let's move into evoking change talk, one of the most powerful and subtle parts of motivational interviewing. If you think about it, most people already know the reasons they should change. What they need isn't more persuasion. It's space to hear themselves say what matters. That's what motivational interviewing calls evoking, drawing out a person's own motivation and wisdom rather than handing them ours. Miller and Rollnick describe it as cultivating the language of change, and it's something you can't rush. It's like inviting a hesitant singer to step up to the microphone. You can't push them there. You have to create safety, rhythm, and trust so that they're willing to try. Szalavitz shows this beautifully in her stories of harm reduction. So many people start to make progress only when they're finally allowed to speak in their own tempo, when they're met without judgment and offered choices that match their readiness. Change begins when people are allowed to be human, not perfect. And evoking is the counselor's way of saying, I believe you already have the lyrics. Let's help you hear them clearly. So how do we do that? We use open questions to invite exploration rather than justification. Instead of, why don't you just stop? We might ask, what would be different for you if things changed? That kind of question opens doors rather than corners somebody. We use affirmations to highlight strengths, especially when clients can't see them. Something like, you've been through a lot and you keep showing up, or it sounds like you're already finding small ways to care for yourself. These moments remind clients that change doesn't start from emptiness. It starts from existing effort. And we practice reflective listening, which in motivational interviewing is more than paraphrasing. It's checking the sound levels. You're making sure what you heard is what they meant. Sometimes you reflect back a small spark of change talk and notice it grow. You're saying part of you really wants to feel free of this, and that reflection can become the seed of new momentum. And then there's persistence, staying steady without pushing. Think of it like the bass line in a song. You don't have to be loud. You just have to keep the rhythm going, predictable, grounding, and patient. When clients lose their way, your steadiness helps them find their rhythm again. Evoking change is not about convincing. It's about creating conditions where hope can breathe. And it's slow work, it's relational, and sometimes the most powerful thing that you can do is simply stay in the room, believing that the person in front of you is capable of change, even when they don't believe it themselves yet. So take a minute here, and I want you to think about when clients feel unheard or disempowered, what can you do to help them find their voice for change? We just talked about OR skills, those open-ended questions, affirmations, reflective listening. We didn't quite talk about summarizing. I talked about persistence instead, so it's more like OR. But OR skills, or maybe there's another skill in your toolbox that you can find to really try to articulate what can you do in that moment when their voice is lost. And our last thing on the agenda today is talking about focusing, or that metaphor of staying in tune. Focusing is one of those motivational interviewing skills that seems simple on paper, but changes everything in practice. It's the act of finding and maintaining shared direction, that steady understanding of where we're going together. Without focus, even the most heartfelt conversations can drift. We might have moments of connection, flashes of insight, but without shared direction, it all starts to sound like noise. Focusing gives shape to the session. It's what helps both counselor and client know what the work is about. In chapter 9, Miller and Rollnick reminded us that focus isn't something that we impose, it's something that we co-create. We don't tell the client what to care about. We listen for what already matters to them. Sometimes that's crystal clear from the start, like if a client says, I want to stop using, or I want to repair my relationships. Other times it's less direct. I just want things to feel different. That's where agenda mapping comes in. It's a way of laying out the possibilities together, maybe even visually, and asking which of these feels most important to start with. It's like building a set list before the show. You can't play everything at once, so you decide together what to lead with. But focusing isn't something that you do just once. It's ongoing. Throughout treatment, we have to keep checking in. Are we still working towards what matters most to you? You mentioned wanting more peace. Is that what you're hoping for? Those questions act like a gentle tuning. They don't correct or control, they help ensure that you're still in sync. And when the focus drifts, and it will, we can reorient without judgment. And we might say, it sounds like things have shifted a bit. What feels most pressing for you right now? That kind of curiosity signals partnership and keeps the work grounded in autonomy. That's where motivational interviewing begins to overlap with Rogers' empathy and congruence. Staying tuned into the client's changing focus requires authentic presence. Being real in the room, not hiding behind technique, it's empathy in motion. And from a Gestalt perspective, focusing connects with awareness and immediacy. We're not theorizing about what a client should want, we're contacting what's alive right now. We're helping the client become aware of their own process, how their energy needs and emotions shift, and using that awareness to guide the next step. So as we close this module, I want to invite you to pause and reflect again. And I don't have a separate slide for this one. But I want you to think about, how do you see MI overlapping with Rogers' empathy and congruence? How does Gestalt's emphasis on awareness and immediacy show up for you in motivational interviewing's focusing and evoking? Or maybe you don't love Gestalt or client-centered. What are maybe some other theoretical practices that you see overlapping with motivational interviewing? It's okay if some of these skills still feel a little clumsy or uncertain. That's just part of the work. Motivational interviewing isn't about mastering a script, it's about deepening your presence. And like any meaningful art form, it's something that you keep returning to again and again, refining your ear and trusting your intuition a little bit more each time. So as we wrap up this week's lecture, just take a moment to bring it all together, to center the chorus line. Throughout this module, we've looked at what it means to honor voice, not just as a sound, but as power, presence, and identity. When we listen deeply and collaborative with care, we help people rediscover their own rhythm and trust it again. In motivational interviewing, focusing gives us that shared direction. It's like agreeing on the key of a song before we play. Evoking helps the client find their melody, the personal themes and emotions that make the song of their own. And when we offer advice, our role shifts into the rhythm section, steady, supportive, never overpowering. And persistence is what keeps the whole piece moving. We stay with the client through tempo changes, mistakes, and pauses. Maybe even sometimes they need to start the song over. We're there to steady the rhythm until they can find it again themselves. This process isn't about control, it's about collaboration. It's about believing that every person has a song inside of them, even if they've forgotten how it sounds. And maybe that's where the K-pop demon hunter metaphor fits in. These stories aren't really about demons. They're about confronting the patterns or parts of ourselves that throw us off beat. shame, fear, self-doubt, all the voices that say that we can't change. In counseling, we help clients face those inner dissonances, not by silencing them, but by integrating them, learning how to make harmony out of what once felt chaotic. So as you move into your own practice, remember this. Your task isn't to teach clients how to sing your song, it's to help them hear and trust their own. So if each client were a song, what would it mean to help them hear and trust their own voice? Just take a moment with that question because that's really what's at the heart of our work. Not fixing, not forcing, but listening until what's already there begins to make sense again.